Prostate cancer screening is actually very controversial right now. Historically, most doctors would say if you were 50 years old or if you had a family history of prostate cancer, you should have an annual PSA as well as an annual digital rectal exam. Now there have actually been a few randomized trials that have shown that potentially organized screening is not the way to go for prostate cancer because it doesn't necessarily save lives. Organized screening can diagnose prostate cancer, but there's nothing to say that the cancers that are being diagnosed are cancers that would have led to prostate cancer mortality. So it's actually very controversial, but right now what most doctors in the American Cancer Society are recommending is that they have a conversation with their physician and really decide if they are candidates to undergo prostate cancer screening, at least make an informed decision as opposed to just having a PSA drawn that might be unknown to them or undergoing digital rectal exams and they don't really know what those results actually mean. One of the major trials that discusses prostate cancer screening is the PLCO trial. It's a major trial. It's 76,000 men ages 55 to 74, and basically what the trial is looking at is whether or not these men actually benefit from screening. Are they going to die from prostate cancer if they proceed with opportunistic screening as opposed to organized screening? Organized screening means that everybody gets screened and there's no discrimination between family history, age, ethnicity, what have you. Organized screening has actually led to an increased incidence in prostate cancer, but not necessarily an improvement in overall survival. So the question is, do we really need to screen everybody? If you look at opportunistic screening, meaning these men have discussions with their physicians, the intervention is the same. As long as they have a greater than 10-year life expectancy, they're offered a definitive treatment, be it surgery or radiation therapy. If you compare patients that have had opportunistic screening versus organized screening, at 13 years, this trial showed that the mortality rate was roughly the same, that there was no benefit to organized screening.